Growth of bone. Let us ask you a simple question. You think that this immature bone, which containing growth plate or epiphyseal plate, you think that this bone grow in the length or grow in the diameter, in the circumference of this bone? Sure, this immature bone should grow in length and should grow in diameter. Growth in length from this growth plate or epiphyseal cartilage, which is the growing cartilage. The cartilage grow. In case of this immature bone, the cartilage from the epiphyseal cartilage grow and undergo a process of ossification. The newly formed bone migrate to the region of the metaphysis. Later on, new bone formation in this femur, if this is the epiphyseal cartilage, growth of cells from epiphyseal cartilage undergo ossification and migrate downward to the metaphysis. Then a newly formed bone formed from the epiphyseal cartilage will push and lead to migration of the previous bone downward. A new bone formed and migration of the other bone downward to the region of the diaphysis, leading to growth of bone in length and sure growth of bone from both ends, from the upper epiphyseal cartilage and from the lower epiphyseal cartilage. This when you reach the age of maturity of bone, cells of epiphyseal cartilage stop to grow and the epiphyseal cartilage itself undergo ossification and the epiphyseal cartilage is transformed into bone, leading to fusion of the epiphysis and the metaphysis. We should notice that the growth of the epiphyseal cartilage is equal on both sides. Let us example the femur. Let us consider the femur is the growth of the lower epiphyseal cartilage of femur the same as the upper epiphyseal cartilage of femur? Sure, no. Always one epiphyseal cartilage ossify first. Epiphyseal cartilage, one of the epiphyseal cartilage stop to grow and ossify first. The other epiphyseal cartilage continue to grow for about 2 or 3 years after the other ossified epiphyseal cartilage. This epiphyseal cartilage, which continue to grow and responsible for bone growth in this case, is called the growing end. Therefore, always one epiphyseal cartilage ossify first, which in this case the upper femoral epiphyseal cartilage ossify first, followed by the lower epiphyseal cartilage. And this is called the growing end of the bone. Ossification of the epiphyseal cartilage and diffusion of the epiphyseal cartilage with surrounding bone under hormonal control and estrogen in female allow early fusion of the epiphyseal cartilages about 2 years before the corresponding male. Therefore, always the female are shorter, has a short stature than males. The bone in males continue to grow for about 2 years after the corresponding female. This is a growth in vertical direction, in length, growth in diameter, growth in circumference, growth in width. How occur? Growth in width occur by the osteoblasts present in the periosteum. The periosteum containing 2 layers, outer superficial fibrous layer and deep osteoblastic layer. The osteoblastic layer produce bone deposition in the periphery, and in the same time the osteoclast in the endosteum. This is the endosteum. The osteoclasts in the endosteum produce erosion of bone in the inner aspect of the cortex, leading to wide medullary canal. Therefore, widening of the medullary canal by the osteoclasts, which are the bone eroding cells, erode the endosteum from the internal aspect of the bone, from the internal aspect of the cortex, and in the same time the osteoblastic layer of the periosteum, leading to deposition of new bone formation of the periphery, leading to increase in the width and diameter of the bone. This is growth in width, growth in circumference, growth in diameter, erosion in the center by osteoclast, and deposition of new bone formation by the osteoblastic layer of the periosteum. This is the growth of bone. Let us now discuss arterial supply of bone. The main arterial supply of bone is this. What is this? Artery called nutrient artery. The nutrient artery enters the middle third of the shaft through an opening called opening 4 or foramen 4 nutrient artery. It passes to reach the medullary cavity. In the medullary cavity, it divides into 2 branches, ascending branch and descending branch. The ascending branch and descending branch pass toward what? Toward the metaphysis, to anastomose with the arteries in the metaphysis, which are called metaphysial arteries. The nutrient artery supplies the inner 2/3 of the thickness of the cortex and supplies the bone marrow. Supplies the inner 2/3 of the thickness of the cortex and the bone marrow. This is the main blood supply of the bone. The direction of the foramen for the nutrient artery. You think that the direction of the foramen for the nutrient artery directed towards the growing end or directed away from the growing end? The growing end here in this bone, which is tibia, is the upper tibial epiphysis. Therefore, this is the growing end and produce excessive new bone formation more than the lower epiphysis. Therefore, the new bone formation here coming from above will direct the nutrient artery and the foramen for the nutrient artery away from the growing end of the bone. The mnemonics to remember the direction of the nutrient artery in the bone is the word toward the elbow I flow. The nutrient artery always in the upper limb direct toward the elbow. To the elbow I flow. And in contrast to the knee. In the knee, away from the knee I flee. Away from the knee I flee. Why? Because the growing end in the upper limb, always remember this, the direction of the foramen for the nutrient artery is the opposite direction of the growing end. The growing end in the humerus is the upper humeral epiphysis. This is the humerus. The growing end in the humerus is the upper femoral epiphysis. This is the growing end. The excessive new bone formation from above will push the nutrient artery and the foramen for the nutrient artery downward toward the elbow. And also in the forearm, the lower epiphysis in these bones is more active. The lower epiphysis in this bone is more active, and this will push the nutrient artery upward toward the elbow, because the growing end of bones in the upper limb is away from the elbow. The upper femoral epiphysis and the upper humeral epiphysis and the lower radial and ulnar. This is the radius and ulnar epiphysis. The growing end will push the nutrient artery to the elbow. Therefore, the direction of the nutrient foramen to the elbow I flow. And the reverse in the lower limb. The reverse in the lower limb, the growing end in the lower end in tibia and fibula around the knee. The upper tibial epiphysis, this is the tibia, the upper tibial epiphysis, and the lower femoral epiphysis is more active. This is the growing end. This is the growing end. Excessive new bone formation away from the knee. This is the growing end. The excessive new bone formation from below will push the nutrient artery and the nutrient foramen upward, away from the knee. The other arteries to supply the long bone. The arteries, other arteries to supply the long bones according to the name of the artery and to the part going to the bone. What is this? This is the epiphysis of the bone. Artery supplying the epiphysis and enters through a foramen, fine foramen in the bone to supply the epiphysis. Artery supplies the epiphysis should be called epiphyseal artery. And after epiphyseal fusion fusion of the growth plate in adult life. Anastomosis occurs between the epiphyseal arteries and the arteries below in the metaphysis. The next artery. Artery supplying the metaphysis should called metaphyseal artery. And the metaphyseal artery enters through a very fine foramen in the bone, and the metaphyseal artery after epiphyseal fusion anastomose with the epiphyseal artery, and the metaphyseal artery always anastomose with the branches from the nutrient artery. Therefore, we have nutrient artery, epiphyseal arteries, metaphyseal arteries, and what is this? The outer layer around the bone is the periosteum. There are many blood vessels supplying the periosteum called periosteal arteries. And the periosteal arteries are extensive arteries. Anastomose with all previous arteries. Anastomose with the nutrient artery, with the metaphyseal arteries, with the epiphyseal arteries. The periosteal arteries supplying the outer third of the circumference of the cortex. Outer third of the thickness of the cortex. Attached to the bone always many muscles. Also, the arteries supplying the muscles attached to this bone, supplying the bone. Therefore, the arterial supply of the bone can be summarized also in this picture. Mainly nutrient artery, supplying the inner 2/3 of the thickness of the cortex and supplying the bone marrow. Nutrient artery. Arteries for the epiphysis called epiphyseal arteries. Arteries for the metaphysis called the metaphyseal arteries. Arteries supplying the periosteum. Periosteal arteries. And in addition to arteries, supplying the surrounding muscles attached to this bone. This is the arterial supply of the bones. Thank you for good listening and good luck.